Hi, I'm Amy DLC with the United Nations Foundation, and we're here at the Digital Media Pavilion at the mHealth Summit. I have the pleasure of talking with Dr. Topol, who gave a keynote this morning, and we're excited to have you with us today. Can you tell us a little bit about your background?
Well, Amy, I'm a cardiologist. I've been a cardiologist for 2.5 decades and been working in genomics and more recently in wireless. And it's all about digitizing human beings. And it's an exciting time. I call it the kairos, the supreme moment in medicine. And that's what it's really about.
Nice. And did you just write a book?
I
Is that
just had a book come out today, the ebook of The Creative Destruction of Medicine. And basically what it does is goes into all the detail of how medicine can change if we can enact a consumer health revolution based on this mHealth principle, that when you take health and mobilize it, and when you have biosensors and genomic data and advanced imaging data, health information systems, this sets up a real rebooting creative destruction of medicine. But really, this is a field that's exploding because we now can measure any physiologic metric with a sensor connecting to a cell phone, which is amazing. We can take cell phones and make them into portable laboratories. We can analyze genotypes in a phone. And we can do all this imaging, and this is extraordinary time in medicine. So, we've never seen this before, all this convergence of technology to understand each person. So, for example, we got digitized books and periodicals, but how about digitized people and each person to be able to prevent illness for the first time?
What are some concrete actions that people could take to help move this along?
Well, first thing is to be acquainted with what's available today that isn't being used. So, for example, why is someone going to have an echocardiogram, an ultrasound in some special laboratory when it could be just part of the physical exam? Or why are you going for a sleep study for $3,000 in a hospital overnight when this could be done in your own home? Or if you have cancer, why are you not getting your genome sequenced to find out exactly what drug and get some of that tissue from your cancer tumor in a fresh frozen, not into the formalin, so it can get sequenced. So there's all these things that could happen today that are much less expensive, much more precise, but they're not being enacted because the medical profession, and I'm sorry to say I'm part of it, is ossified. It just does, it's so lack plasticity, lack fluidity, so resistant to change.